Cruising down Highway 67 near Bono, Texas, teenager Tim Bales and his girlfriend Mackenzie had plenty to talk about. Finishing high school, their future together, or their baby that would soon be born. Then came a pair of gravel trucks.
We sideswiped the back tandem of one 18-wheeler and spun, and there was a second 18-wheeler right behind that one that he tried to swerve off the road, but he said we were in such a spin that it didn't really matter. He tried and he hit us anyway. A doctor from another hospital that happened to drive up on the scene, he started a timer and said we have about an hour before it's too late.
With Tim and Mackenzie unconscious and critical, CareFlite dispatches the two closest helicopters to transport them.
I was unconscious and in shock when they got there. My CareFlite team had said that it was trying to get me inside the helicopter was trying to put a couch through a doorway because of my dislocated hip, that they had to kind of maneuver me through the door.
They lost their baby, but over time, Tim and Mackenzie made a full recovery. He could actually wrestle again for his high school team.
Really no way.
She is planning to attend college for nursing. They were among the 50,000 patients that CareFlite transports each year.
So thankful for what they do, and everything was just done so perfectly, and if it hadn't been, then we probably wouldn't be here.
You're having CareFlite, you're not really having a good day, but our job is to make that day survivable and to try to make it better for people who are in a terrible circumstance. So CareFlite's really its people and their commitment to the highest level of air and ground EMS service in the country.
CareFlite got off the ground in 1979 when two hospitals, one in Dallas and one in Fort Worth, formed a nonprofit centered around one Bell helicopter. It was the first collaborative air medical service in the United States.
The Methodist Hospital in Dallas and the hospital here, which is Texas Health, Harris Methodist Fort Worth Hospital, came together 35 years ago and collaborated on how they could work together to improve the health of the people in the communities we serve. And that began the whole thing.
It wasn't long before CareFlite added a ground ambulance division and fixed-wing airplanes to keep up with the medical needs of a growing metroplex.
Later, Baylor came on board, and now we have two other systems, JPS, which is the tax-supported system in this community, and Parkland in Dallas. And so 5 hospitals support this program. All of these hospitals simply come together to improve the health and to be here when people like you and I need the service.
Not only has CareFlite expanded to 5 hospital systems, but today the fleet consists of 9 helicopters based across North Texas. With state-of-the-art equipment and highly trained crews, the helicopters are nothing short of flying emergency rooms.
Inside this helicopter, we can do everything that an emergency room does in an ICU. So we function in the back of a helicopter just like we would as an ER and as the ICU. We can deal with trauma. We do critical care in the back of this air ambulance.
With its fixed-wing King Air, CareFlite can swiftly move patients, transplant teams, or organs without delays to cities across the United States.
I think obviously our name makes it sound like it's helicopter-based, which it to a great extent is. But we have a very brisk ground division, whether we're doing 911 transports or whether we're doing inter-facilities. And these people deliver the same quality care that the air services do. There are times when air medical is not available because of weather, and we have to translate that into a ground transport, and we expect the same level of expertise on the ground that we did in the air.
The ground division is actually the larger division of CareFlite. We have both 911, non-emergency operations as well too that do transfers between facilities. We have wheelchair vans as well that take people home from facilities to take them to doctor's appointments and home from those as well too.
It's impossible to be the best without constant training. CareFlite conducts frequent simulations in the field to help their employees and other emergency responders refine their skills and learn new ones.
Our commitment to education is unsurpassed. We have one of the most sophisticated state-of-the-art EMS training centers in the country, the Maybe EMS Training Center. The company's always believed that the way to the highest quality care is with the highest quality of education.
We're giving you some medicine to make you sleepy.
We have very high-tech
patient-human simulators. They act like real patients. They can do just about anything that you and I can do. So we have real-life scenarios that have been approved, and they go in just like it was a real patient and do all of the things that they're supposed to do. Intubate the patient, put them on a ventilator, put them on monitors.
We have people who come from all over the U.S. and from other countries for the training that we give here. And in fact, our most distant student came from Korea specifically for that program last year.
And the thing about the employees is they're willing to train and to do those things that prepare them. They are the very heart of this company, and every day they get up with nothing on their mind but taking care of the public. They're public servants. They're highly qualified, highly skilled people.
My calling in life is to help others, and that's something we do on every call we go on. You know, whether we are transporting a child to a trauma center or going on an airplane flight to bring somebody home that's coming home on hospice for their wishes to pass away at home. We're serving others, and that's what I feel like my calling in life is, and that's very much satisfying.
Because we have quality from the inception of the call in the dispatch center to the completion of the run, whether it's air or ground, that's a very big team effort that's required. We do it 24/7, we do it very well.
You take for granted, like, you're like, oh, there's a CareFlite helicopter, like, you don't really think about it, you know, what's going on, what's happening, and then kind of puts it into perspective that there's really someone's life that's at stake at that moment.
It's true since its founding that it's carried about 750,000 patients by air and by ground, but what it really is, it's about 500 people who've heard the calling of CareFlite and have come here in order to bring help and hope to people in their most desperate situation.
It's really awesome to know that there's people that just devote their whole lives to saving other people.